a small little exercise program that we give people who are suffering from neck or upper back pain or any other postural induced problem that may be happening, and that sometimes even includes shoulders or anything else. So remember, these exercises are always done in conjunction with any other stretches or any other sort of heating or anything that we may be getting you to do at home. This is purely just to demonstrate exactly the little movements in case you're having any problems doing it. So the first one that we often give people is some simple cervical or neck range of motion exercises. So when we do those, we like to sit up nice and tall as we can. And the first one is just a simple rotatory type of movement. Sometimes we jokingly call this the carnival clown, or around January we often call it the Australian Open, because you'll be turning back and forward like you're watching a game of tennis. So it's very simple, sitting up nice and tall. Imagine there's a helium balloon on top of your head just lifting you up, and that keeps us in that nice neutral position. And then we just gently rotate around to the left here as far as we can. Now if you're experiencing, now obviously you can see my range of motion is reasonably good, but just imagine I was getting pain at about the 45-degree mark. I would turn to about 45 degrees, noting where my nose lines up to with something on the wall, and then I stop short of pain. So you don't want to be pushing into pain. So if you start to feel it starting to tighten up like it's about to hurt, that's where we stop, and then we just gently turn back the other way. Again, you can see if I could only go 45 degrees, I'd be lining up my nose with the doorway there, and I'd hold that there for a second and then coming back. And you can see the movement's nice and slow, exactly like a carnival clown. You can have your mouth open if you like for full effect, and that just helps us with the range. And you'll go back and forward anywhere between 10, 15 or up to 20 times. So we give that one, that's a real preliminary exercise that we give a lot of people who have got a sore neck or their neck's locked right up. As we get better, or depending on the condition that you have and we've got to do other things, we get you to do other ranges of motion or work on the other planes of movement. So we still do the rotation movements, and then we can start to add in some gentle flexion and extension. You notice I'm just controlling the movement, controlling the speed. Again, not pushing into pain, not sort of shoving back to where it might hurt, just gently coming up into a comfortable position and then working back down again. And you'll notice basically just trying to tuck the chin into my chest as I do it, and then coming back up, keeping the chin under control, not just tilting the chin up, it's more sort of leaning back as we go, as if we're trying to look up to the ceiling, something level with above the top of our head, and then coming back. And again, you do that anywhere from 10 to 15 times, up to sometimes 20 if required. Then the next movement is lateral flexion. So we go side to side. Again, sometimes it's good to do this in front of a mirror so you can see exactly the angles that you're achieving with it. Try not to lift the shoulder up and sort of cheat your way over. We're just trying to just simply move the neck and ensure that we're improving that neck range of motion as we go. Again, working nice and slowly. Again, not pushing into pain and trying to sort of shove past that painful zone, because all that's going to do is potentially irritate your neck. So I guess the best way to remember those exercises is either the carnival clown, or if you're doing all three of them, think that you're either going to be agreeing with people, disagreeing with people, or questioning people. It's a nice simple way of remembering the exact movements when you've got to do them. And any of these things quite often will get you to do them anywhere from 3 to 5 times throughout the day. After a heat pack's an excellent time to be performing them. Now, the next exercise that we do on top of that, and it's more of an activation exercise. Everyone knows about core stability through their lower back and through their torso, but we've got to remember that the neck also has stabilising mechanisms. And this exercise I'm going to show you is a great way of turning on that stability, as well as retraining your posture and retraining your neck to work a little bit better. We call this one a chin tuck. Okay, or a chin retraction exercise. They're the technical names for it, but we often like to call it the reverse chicken dance. So we're pulling back in a reverse fashion to how the old chicken dance that used to be around in the 80s used to go. So I'll turn sideways so you can see me a little bit better there. Sitting up nice and tall again. Remember the old helium balloon on top of the head lifting us up. And then we just gently retract the chin back and hold for about anywhere from 5 to 10 seconds, and then relaxing back again. And then squeezing back again. You can see it's a very subtle movement. It's not a big movement. And you'll notice the range that I have, if this is the neutral position where I start, obviously I can come forward a lot more. And that's the mistake people make. They pull back and then they come way forward in order to feel like they're pulling back more. It starts from that neutral good position and then pull back away from it. and then back to neutral again. Don't come forward. Sometimes you can, if you want, just rest your chest, rest your hand on your chest with your finger on your chin, and then you just gently pull back. Now you notice I don't go the full range that I can. You can see with my neck I can actually go right back like so. You don't need to do that. You only go back around about sort of a comfortable zone, which you'll generally find is around about 50 to 60% of your range. And then remember, we just hold it there for a few seconds and then come back to neutral, and then pulling back and back to neutral. All right. Again, doing around about 10 of those if we hold it, depending obviously how long you need to hold, and that's something that we'll advise you when we're giving you these exercises at your appointment. But like I said, that's a neat way just to jog your memory on how to perform that one appropriately. Now, another thing that we want to work at with these types of exercises is, of course, your posture. And that's the big crust of all this, because if obviously your posture down here or between your shoulder blades is a fair bit forward, then obviously we're going to have a tough time trying to fix that neck over the long term. So one of the exercises is just adopting a good posture several times throughout the day. It's a great thing to do to have a break when you're at the computer or driving the car or anything like that. Obviously, if you're driving the car, do it at a red light or pull over the car, but at computers is a great way to sort of break that monotony of being stuck in this type of position. So we basically sit up nice and tall. Imagine there's a rubber band going from one side of your shoulder to the centre of the chest and then across to the other, and we're trying to stretch that apart, or squeezing between the shoulder blades. Whichever of those sort of methods helps you activate and squeeze the shoulder blades back nicely, and then we pull the chin back in, sitting up from using the lumbers. Okay, so remember, posture comes from the ground up, so if we're still sitting like this, it doesn't matter how hard we pull the shoulder blades back or try to stretch them apart, we're not going to be able to get up into a good position. So we make sure we sit up nice and tall here, bring the shoulders apart, bring the arms to our side. I like to turn the thumbs out as we do it, and then just gently pulling the chin back into a comfortable position, so we're in that neutral position, and we hold that for 10, 20, 30 seconds, and then get back to work and do what we need to do. Now, you can see obviously the muscles that we're using when we perform this good postural position are the muscles that I'm about to show you in this next exercise. The next exercise we call a scapular squeeze. Sometimes we give it a few different names depending on what's what. Sometimes we call it the no moneys, where we stand there and squeeze back with our palms up like we've got no money. Sometimes we call it wheel taps if we're doing it in the car. Imagine steering wheels here, and we squeeze back away from the steering wheel and then come back and tap the wheel and then squeeze back. So this one we adopt that good posture like we were before. Sitting up nice and tall, the old helium balloon, stretching the elastic bands across the chest, and then gently just squeezing back. I like to always have the palms up when I'm doing this. So we squeeze back like so, holding in that nice neutral position for around about 5, 10, 15, 20 seconds, or the whole duration of a red light if you're doing it in the car, and basically just gently pulling the arms back. Now, a lot of people when they first start, they'll have a lot of arm movement, which is fine, but as you get better and better, you'll find that you'll be able to be a little bit more precise with the arm movement, and you'll be able to squeeze back utilising primarily the shoulder girdle or the shoulder blade going back, and that's going to help open up the chest and hold us in that good position. It kind of works the sling across the back of the shoulder blades, and that's the main area that we need to work on. As with any exercise, in order to sort of get those muscles doing what we need them to do on a daily basis, which is contract and hold rather than turn off and on and off, because a lot of people do these types of exercises at the gym and all they're doing is turning the muscle on and off. We need to teach it to hold and lock in that position, and that's going to help it work a little bit better throughout the entire work day for us. So these are some of the great little posture exercises that we can do, and if you have any problems with them, or you notice that they're causing any undue pain or stress or anything on the body, by all means give us a call here at the clinic and talk to either myself or one of the other practitioners, and at least what that's going to do is help you to help yourself throughout the day. So any other problems, make an appointment or give us a buzz. Thanks.